There's two main functions of the testicles. Number one, sperm production, right? So making offspring, having kids. And then the other aspect is making testosterone. So, your male hormone that's required for bone health, mental health, muscles, etc., etc. So those are the two biggest functions of the testicles.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. This week's episode is titled Ballin' Out, all things related to the testicle. Justin, this was one of our great live episodes from the past SMSNA meeting with our good friend, Dr. Premal Patel.
Yes, it was a really fun episode. We always like to do them live. I think the audio quality is a little bit not as good, but that's okay. It's going to be really fun. Yeah. I think the energy is there. And just as a reminder, Dr. Patel, he's been on here several times. He's a good friend of ours. He's an assistant professor at the Department of Surgery, Section of Urology at the University of Manitoba up in Canada, potentially the 51st state of the United States.
Maybe by the time this episode comes out in a few days.
Maybe by the time it comes out, who knows? His focus practices on male infertility, men's health, sexual dysfunction, and he's based out of the Health Science Center in Winnipeg, Manitoba. So obviously he knows balls. We know balls. This was a really fun episode to really just talk about balls, because I think guys know what they are, but there's a lot of components that patients come in and they ask me, what is this? Do I have a lump? Is it a bump? And then I explain them the anatomy of their testicles, what things are. And so I think this is a good, just general, funny, informative episode where we kind of break down the testicles, the scrotum, and everything in between.
Yeah, I mean, look, the scrotum is rather simple, right? You got two spherical kind of things inside there, but there is a little bit more intricacies to it. And yeah, if you've ever kind of touched around there and you're like, well, there's something behind the testicle. Well, that's because there actually is something behind there. And so we talk about that in the episode, and very informative. And again, it's always just better to be a little bit more educated about this stuff.
Yeah. So I think let's get into it. Thanks as always for listening. Download, subscribe, follow us on @theManUpPod on TikTok, Instagram, Twitter /X, and YouTube. Subscribe. We did this one in person, so you can see all of us together is really fun. So thanks again. Enjoy the episode.
Listen up, guys. Your shoes say everything about you. Whether you're heading to a game, going on a date, heading to the office, or meeting up for drinks, you need footwear that turns heads and keeps you comfortable all day long. That's where Koyo comes in.
Handcrafted in Italy with premium leather, Koyo shoes are built to impress and built to last. Stylish, incredibly comfortable, and the best part, these are high-end designer shoes at a fantastic price. Casual, sleek, versatile. Koyo is the upgrade your wardrobe's been waiting for.
It's time to step up your game and get some Koyos. And right now, you can get your first pair 15% off by going to the link in our post or simply entering discount code MANUP. That's MANUP. So go visit koyo.co today and find your perfect pair. We are joined by our good friend, Dr. Premal Patel. And today, we got a really good topic we're going to talk about. We're going to talk about, some people call it balls, some people call it nuts, some people call it nads. You call it whatever you want, but it's going to be a great topic to talk about. So, Dr. Patel, thank you so much for joining us.
Thank you, gentlemen. It's always an honor to be on this fantastic podcast, so I really appreciate it.
Great to see you in person, as always. You don't have to go back to Canada. You could come hang out with us.
You can actually just stay here. All right, so let's start very simple. When we talk about your balls, we are talking about a few things. So can you break down the anatomy of the scrotum and what's inside?
Yes, 100%. So we talked about your gonads, your nads, your testicles, however you want to phrase this. So, most men will have two testicles. They're inside that scrotum, which hangs outside the body. The reason being is that the testicles want to be in a cooler environment where sperm production, so that's why the testicles are external. When it's nice and cold out in Manitoba, where I'm from, those testicles like to ride high. When it's a warmer day outside, you're in the hot tub or the pool, you can notice that the boys are going to be hanging a bit lower. And then you have that scrotal skin or the scrotum. There's a few different layers, and then essentially each testicle kind of has its own little kind of, own blanket around it. And so that's where you have some fluid in there that's sort of protecting the testicle, but they have their own independent pouches that oftentimes some patients may think that there's, both balls are just sort of floating around in the wind, but they actually have their own little spaces.
Nice. And, there's a lot of things that the testicles actually do. And I think that some people don't really realize that. So can you explain to us actually what the role is testicles have in men?
Yeah, absolutely. So testicles, there's two main functions of the testicles. Number one, sperm production, right? So making offspring, having kids. And then the other aspect is making testosterone. So, your male hormone that's required for bone health, mental health, muscles, et cetera, et cetera. So those are the two biggest functions of the testicles.
All right, listeners. So making sperm and making testosterone. All right. So let's, I know you touched on it really early on in your first answer, but let's again go back to this question. Why are testicles outside the body?
Yeah, 100%. So just as I talked about before, the testicles are outside the body because sperm want to be developed in a cooler environment. So typically the testicles around a couple cc's, cooler than the rest of your body temperature. So that's the main reason why they're outside and lower.
Yeah, and it makes sense. Like that's why goes away. Can go up to your belly button if you're in Manitoba in the winter because it's so cold, and then they drop. So
when you're in Miami,
and when you're in Miami, so there is method behind the body madness, and I think it's always a fun fact, and people never really understood that, and I think it's always a fun point. Now, one thing that a lot of patients come in and they ask, they're like, one of my nuts is kind of bigger than the other one. Is that normal for patients to have one testicle bigger than the other?
Yeah, it's a great question. I think it's getting down to sort of the history of it, right? Is that testicle smaller randomly, bigger randomly, or is it after some sort of, say if you had a hernia surgery, and so some men can have compromise or blood flow issues to the testicle that can cause that testicle to shrink. However, if they say, my one testicle is actually getting bigger over time, and maybe in their 20s and 30s, which is actually the highest incidence of testicular cancer. So I think the one concern is there something potentially growing there that's causing the testicle to be bigger? If this is something that they've always had, maybe something you're less concerned of, but generally speaking, both testicles should be same size.
That's a fantastic point for our listeners. They should be, especially men, 20s, 30s, even 40s, you should be doing like self-testicular exams, just making sure that you're not noticing anything abnormal, because if you are, you should go see a doctor. You shouldn't sit on it, which I've had some patients where they're just kind of like, I'll kind of see if it kind of goes away. And after 6 months, they're still like, oh, it's just getting harder and harder. So very important to do to check your own balls out. Now, we talked about, is it okay for one to be bigger than the other? How about hanging? Is it okay for one to hang lower than the other?
Yeah, so usually the left side hangs lower, and it's just sort of how the blood flow kind of different between the left and right side, where how the veins are. So generally speaking, the left side does tend to hang a little bit lower than the right.
Now, can you have such things as long balls? In Curb Your Enthusiasm, they called him Long Ball Larry. I may have been called Long Ball Larry by my family members for reasons throughout the years. Can you actually have long balls, and can this be a problem for you?
Yeah, so I guess it all depends on what are we defining as long balls. Is that just a big hanging scrotum that is kind of coming through your zipper when you're trying to put your pants on? So I think it just depends on that. There are patients though, as they get older, maybe things are starting to sag down a little bit more, and that if they're going to the bathroom, some patients may say, it actually is touching the water in the toilet bowl. So they can cause some problems and stuff like that, or they may prevent them from wearing certain types of clothing.
Yeah, I mean, not from any personal experience or anything, but I may have had to not be wearing boxers anymore just for personal pain.
TMI.
Listen, I have guys that come in and they're like, listen, it's kind of hurting when I'm like running and slapping around. And I was like, I think you got long balls. You got to get scrotal support. So boxer briefs. Some people I actually tell to wear tighty whities when they're exercising, or at least athletic underwear, because testicle pain can happen from slapping around during exercise.
100%. You got to support the boys.
Yeah.
So look, one thing we always see guys commenting about is testicle size. You hear the phrase big balls or tiny nuts. So, does testicle size really matter?
Yeah, so let's break that up again. What is what does size of testicle correspond to? So, the most important function of the testicles, we can, probably say is going to be sperm production, right? It's passing on, keep evolution going, have the population going. So the majority of a testicle size is actually sperm or sperm production, right? So if you may have small testicles, which, we're all three infertility specialists, that may include that there could be some issues with sperm production. So when it comes to larger testicles, maybe more likely that sperm production is intact. As you talked about earlier, if the testicle is growing over time, which it shouldn't, especially outside of, puberty, you start thinking, is there something maybe sinister going on that you may need to be checked out? But, kind of going back to it, the testicles, the size of it really does correspond to some level of sperm production.
Yeah, it's a great point. Now, that kind of leads to the next part of the conversation where we're alluding to some bad stuff, but some of it is not necessarily all very bad, right? Not everything that expands in your testicle means you have cancer, right? Now, the one thing I do want to talk about to start off is a hydrocele. Now, what is a hydrocele, and what do we do for them?
Yeah, so great question. So, it's not always bad stuff when you're having different, your testicles are growing. It's not always you have to jump to cancer. It's important to get checked out, but there are things like hydroceles, as you mentioned, which basically the testicles kind of has its own sleeping bag, and it develops some fluid, and it can get stuck around there that is not getting absorbed by the body. So you may just have fluid that builds up around the testicle, and honestly, if, you have an ultrasound, you've been checked out, it's nothing worrisome, if it doesn't bother you, you leave it alone, right? If it's growing, causing you issues, now you can't put on your favorite pair of boxers or briefs. Okay, let's talk about that and figure out what we can do for it. But hydroceles, generally are, they're benign, non-cancerous, and if they're not causing you bothersome symptoms, you may not need to do anything about it. There are different types of hydroceles. There are communicating hydroceles, where basically you lie down, the fluid goes away. You stand up, you start seeing fluid kind of develop in the scrotum. So it really depends what type of hydrocele you have. Those ones generally in younger patients, and where we see older patients may have these big hydroceles, which is basically fluid buildup around the testicle.
That's a fantastic explanation of hydroceles, and I really want to highlight hydrocele is a benign condition. Mm-hmm. So if you are not bothered by it, you really don't have to get anything done for it. But let's talk about something else. Let's talk about a fluid collection that can form on the epididymis. So there are things called epididymal cysts, which can form on the epididymis or even in the testicle. So can you talk a little bit more about that?
Yeah, so when you think about the epididymis, what is it? You have your testicle where sperm is produced. It goes in that epididymis where it learns how to swim. There's all these tubes that the sperm like to swim through. If you have a weakness in some of the layers, it may start building something called a spermatocele or an epididymal cyst, which is basically just fluid buildup of sperm in this cyst. Now again, non-cancerous, benign, something we necessarily don't need to do anything for, but if they're large and causing discomfort, we may talk about either draining it or removing it. The one piece of this is, if you're somebody who's young and you're still thinking about having children or you want children, you always want to be a little bit careful of these cysts and removing it because you could cause some blockage to the tubes and impair sperm flow.
Yeah, I mean, I don't know how you counsel your patients, Kevin, but I Premal, definitely see guys with cysts, and if they're of childbearing age where they want to have kids in the future, I really provide reassurance and I try my best to say, like, let's hold off. Let's try not to do this because I really don't want to take those small, not zero chance of causing some kind of blockage in your epididymis. And thank you for describing what an epididymis is, because I think a lot of guys don't really understand that your testicle has kind of multiple components. Yeah. It's not really part of your testicle, it's outside of your testicle, but the path to the outside world for a sperm is not just the testicle to the urethra, and the epididymis is an important part of that.
Yeah, and I'm sure it's not uncommon that you may get a referral for a patient who felt a lump on their testicle. It's really just their epididymis, right? They just didn't, they don't know what it is.
Oh, all the time.
Yeah.
All the time.
All the time. And they're like, this is cancer. I'm like, no, this is just your epididymis. And the truth is, everyone's epididymis it's so weird how different they are. Like some are like really loose and like kind of flapping around, and then some
are like smaller, a little bit less palpable, right?
Yeah, it's quite interesting, really. I gotta say,
I mean, I don't blame patients though. Like if you don't know, that you're supposed to have something there, and you feel it for the first time, like really pay attention to it, I'd be like, fuck, what is this?
No, you're right. And also, I'm glad they're coming in, right? I'd rather have them come in and say something about it.
Okay, this is embarrassing, but I was probably in my second year of practice. No, actually my first year of practice. I was examining myself, and I'm like, shit, I got a lump. I was like, I got something going on here. I need to get an ultrasound. So I talked to one of my colleagues. He's like, man, you're just probably feeling your epididymis. I'm like, I'm an infertility specialist. I know what I'm feeling. To the ultrasound, it was like literally my epididymis.
So for all patients at Manitoba, I'm just kidding.
Damn. So listen, we can all get tricked,
We
right?
can all get, listen,
It's all simple until it's your own body.
we're just being vigilant here.
Yeah,
you know?
yeah. It's all simple until it's your own body, right? And then you start freaking.
Well, you
the
start
fuck
going
out.
down this tunnel. You're like, oh man, what's gonna happen?
Right.
My children. Like I gotta look at,
Dude, it's true. So, yeah, Kevin, I think you got this question.
All right, so let's talk about scrotosebaceous cysts. What are they, and can I do something about them?
Yeah, probably one of the most challenging pieces that we tend to see, and it's very tough for patients because unfortunately it's just some oily debris that kind of builds underneath the skin. You may have multiple cysts, maybe you have a few cysts. The trouble with them is that people will come in with multiple cysts around the scrotum. In some patients where there's just a few, you may just be able to get underneath the skin and excise them and remove it. You may, the nice thing about the scrotal skin is, as we all know, it can be quite forgiving. If you have scars, it tends to be less noticeable over time. The problem is when you have multiple cysts that you talk about, how much actually scrotal skin do I have to remove? And is it even feasible to remove it? So, it is, again, about discussing with the patient, how bad does this bother you? How aggressive do we want to get? Fortunately, there are treatment options, but there are risks and benefits to it.
Yeah, I think that this is also difficult, and it goes back to the conversation we had a while back in one of the episodes with like the pink pearly papulus. And I think that a lot of patients, they themselves are not worried, but especially guys who are in new relationships or sexually active and single, they're worried that people think that there's some kind of STD or something. And these cysts kind of look like pimples sometimes that you just can't pop, right? Mm-hmm. A lot of these guys come in, they're like, tried to pop this thing. It feels like a little bit of a zit that I can't pop. And, a lot of times I do a lot of these removals under local anesthesia. I mean, we can all do them in the office, remove a couple of them. But some of these bigger ones, they are, and I don't blame the patient for wanting them removed. They're, I've seen enough where they're very big and they cause a lot of distress for the patient who doesn't want to engage in sexual activity or things like that. But the important thing to know is A, that we can address them, and B, that they're not cancer, they're not STDs, and it's something that, just by educating and making sure that people know that we can make them comfortable about them.
Yeah, totally. Every patient, every single human being is self-conscious of their genitalia.
Yeah.
And so, if you feel bad for some of these patients, some of them have never been in a relationship, or they've prevented, or they actively avoid it because they're scared to think what their partner may think. So, the good things are treatment options. It's about having that conversation.
Yeah. Now, some people, we did talk before that most people have 2 testicles. However, some people do have 1 testicle. Either they were born that way, or they had one removed either for cancer or atrophic or a torsion or something. Now, does having 1 testicle impact your fertility or your testosterone levels?
Yeah, it's a great question. And fortunately, there's been some really long-term studies looking at like some of the Danish population and patients who've had a testicle removed for cancer reasons. And when they looked at patients who have 1 testicle versus the general population, they actually found the fertility rates were similar between groups. So, the nice thing is that do we need to, if someone getting a testicle removed, do we need to freeze everyone's sperm beforehand? Based on the data, not really. So, we talk about it, may not necessarily need to do that. So fortunately, that's a good thing that we can kind of keep track, and the testosterone levels tend to be normal as well. But the biggest thing about this, and something that we always tell patients when it comes to testosterone being optimized, diet, exercise, nutrition, proper weight management, all those is going to be key.
Now, if I have 1 testicle, can I do something to make it look like I have a normal pair of testicles?
Yeah, absolutely. So you can get a prosthesis placed, right? So you can get a prosthesis to even it up, so you're not walking to the right or to the left, to keep you balanced. So you can get a prosthesis, and how we sort of fill it up is that it's a silicone. It's silicone only, but then we fill it up with like saline in there to match the other side. So that's an option in terms of just for the cosmetic appearance.
And it's sized appropriately too. It comes in a few sizes.
And it impressively feels pretty much the same. I mean, obviously, we've touched enough nuts to recognize the difference. But I think that, we've also put a couple in ourselves over the years. And, it's interesting because I find about 50% of the patients that I do orchiectomies, and I think this is important for our listeners, right? If you are someone who has to have your testicle removed, unfortunately for cancer or something like that, make sure your provider is offering you at least the option for a testicular prosthesis. I always do. I'd say about 50% of the time that they say yes, and even if you decide against it at that point, it's never too late to go back and do it. It's a simple procedure that we can do. The risks are relatively low, and if it makes you feel better. And just for people asking, when you do have a solitary testicle, it doesn't just like sit in the middle or anything. It doesn't sag in the middle. It stays on the side because, like you said, each testicle has its own little pocket or pouch inside the scrotum.
Yeah, 100%. So at the time you have a testicle removed for cancer, so simple just to throw in a prosthesis at the same time. And you guys probably deal with this all the time. It just is my own experience. As soon as someone has a cancer diagnosis with a concern, that's all you're thinking about. So sometimes you just have to tell the patient, listen, cure rates are like in the 99th percentile. You're going to live through this. We'll get you through it. But if you're going to be bothered by the cosmetic appearance, we can toss it in now or we can toss it in later, depending on what they want to do.
All right, I'm looking at this next question, and I love it. This is going to be a fantastic question right here. So, Dr. Patel, please tell the world, what is scrotox?
Oh, scrotox, and we talked a little bit about this. We may not see as much of it up in Manitoba, but it's
I think it's quite a bit in.
No.
No?
No, I don't.
It's just basically just getting rid of the wrinkles of the scrotum, basically injecting Botox all around the skin, keeping it nice and clean and dry. Depending on, this I'm curious about your guys' perspective. How many people actually come requesting this? Very few come in Manitoba requesting anything at scrotox.
I mean, in LA, I do know it's a thing. I don't really advertise that that's something that I do, but I do know it's a thing. And it's,
Yeah, I mean, listen, you're making your nuts look like from a brain to a marble, like a nice smooth marble. I have not had patients ask about it, but I will say that I do think that there is one role that you can also do Botox for in the scrotum, and that's for a painful retractile testicle, right? I have done that, or I have not done that, but I've been during fellowship, I had done one. And basically, so what you can have, and some guys have this, and this is something we can talk about now, is some people, when we ejaculate, our pelvic floors tighten, and also, our cremasterics, which are the muscles, a layer around our scrotums, inside our scrotums, which is why our balls drop and elevate. Sometimes you can have a very strong cremasteric response, and that can cause some pain for some people. And so what you can do is you can inject the cremasteric muscles to relax them with Botox so that you don't have a painful retractile testicle. So I have seen it one time for that, so there is a potential practical medical intervention. But listen, if people want their scrotum smooth as a ball, God bless them. Let's go.
And that's a great point about the cremasterics, because sometimes I've taken patients for surgery where we actually cut the cremasterics. Right. But the nice thing would be that if you do Botox beforehand, see if it works.
Right.
And if they're like, okay, that works.
Because sometimes even if you still take the cremasterics, there's still sometimes maybe some anatomy, some scar tissue, something is still causing that retractility. So
absolutely.
So maybe good algorithm for you now.
That's nice. I like it.
All right, man. So listen, I think one thing that the theme that we're getting here, and I think most guys are already doing this, they think about their nuts a lot. They're thinking about them, they're touching them, but I don't think that they're doing anything about it. And that's the real problem here. Because we all know that guys delay their care no matter what. But when it comes to their nuts, I can't tell you how many guys come in with a problem that was bothering them, whether it was cancer or hydrocele or issues with concerns of testicle size or something that they felt was like maybe a cyst, and they just never do it. They delay it for 6 months, a year, and we have a problem. How often do you recommend guys examine themselves? How do you recommend they examine themselves? And where do they go if they have an issue?
It's a great question, and I think that's the whole piece about, as much as it's sort of a sensitive topic, we don't want to, maybe we're embarrassed. It's one of those things that it's very easy to examine the testicles. A lot of the treatment options, there's so many different good treatment options if something is going on. When it comes to testicular self-examination as well, just doing it in the shower, right? You go to the shower, making sure that you're feeling each testicle one by one, and just getting a really good sense to make sure that there's no lumps or bumps or any differences between them, and just making sure that you're checking out both testicles. And then if you have questions, first go off to your primary care physician if you have one, or then seeing your urologist, right? It's very easy to get in. This is something that we do day in and day out. This is our lives. So we know, we know how to take care of patients, and we know how to diagnose anything that you're concerned of.
As you were saying that, I was picturing myself going in the shower, turning on the shower, and performing a self-testicular exam.
I was also picturing you going in the shower.
All right. So look, first off, Premal, thank you so much for taking the time. For our listeners, you probably recognize him because this guy is one of the really loved episodes on, vasectomies.
Yeah.
It's really had a really good response to that. So thank you so much for coming and hanging out with us and talking about nuts, man.
No, honestly, I appreciate it. I love everything you guys are doing. I'm so proud of you boys, and I love the opportunity.
So just tell our listeners where they can find you.
Yeah, so if you ever want to brave the cold and come up to Manitoba, we're at Men's Health Clinic Manitoba. You can check out our website at mhclinic.ca. Always happy to help our patients out.
Listen, he's a leader in the men's health space. Come out of Canada, come to the States, and we always miss you. We always miss you. We love hanging out with you, and it's always a real honor having you on the podcast. So thanks for coming on, and thanks to our listeners. Until next time.